I'm here to talk to you about Tracker Lending Library. But before I talk about Tracker Lending Library, I want to talk to you about Recycle Health, a 501c3 organization that I founded. This obviously is me, and as you can see, I usually only wear one tracker. These are ads from Fitbit, and Fitbit markets to 18 to 34-year-olds, the heaviest purchasers of trackers. They wear spandex in the ads, they look fit, they look healthy. And I've been reading a lot of reports about tracker use, and Kamal also referred to the incredible drop-off rate. So what happens to all of these trackers that people abandon? I was reading a number of these reports late one night, and I literally woke up the next morning and I thought, what if we could be like modern day Robin Hood and take all of these trackers from people's junk drawers and give them to the people who might benefit the most: underserved populations, older adults, people with chronic disease. And so this turned into Recycle Health. We started off with a Facebook page, we now have a website, and to date we've collected over 2,000 trackers. Most of them come in little packages like this, but we've also had generous donations from a number of vendors, and we've had a lot of organizations who send boxes to us, such as Canopy Lake Park, where people's trackers fall off on a roller coaster, and every morning they collect them, and we get a couple of boxes every summer. We've been fortunate enough to have some really nice press in the Boston Globe, in USA Today, and so on. We've had some celebrity endorsements, mostly thanks to the kindness of students and former students. So this is one of my students. She works for George Foreman III, who did some nice tweets for us. Another student was a personal trainer for Mark Wahlberg, so he also tweeted about us. And all of this increases our visibility in search engines. So what do we do with all of these trackers? A lot of them are donated we give them to individuals who request them. And we've also been working with a lot of different organizations, including veterans-run organizations. Recently, we've been donating a lot to developmentally disabled adults as part of fitness programs, and we do research studies. So one of our published studies was really beneficial to us because it really helped us in understanding what are some of the barriers to tracker purchase and use, especially in older adults, and what are some of the facilitators to increasing physical activity. So this is one of our published papers. We have a number of ongoing studies taking place, and our newest initiative is Tracker Lending Library. One of my interns made this. I had the idea of doing something like this. He actually didn't know what a card catalog was. I explained it to him, showed him some pictures, and he's like, oh yeah. And then he did this lovely logo for us. So we're going to be piloting this in 3 doctors' offices in the greater Boston area, and we'll be providing them with Fitbits, and then the physician will essentially prescribe Fitbits to their patients, who will walk out with a medical assistant helping them get it set up, and they will be using it until their follow-up appointment. The first lending library was in what was the name of the town turned into Franklin, Mass, to honor Benjamin Franklin. The first large public library, we all know, in the Boston area. And now we have the first tracker lending library. We're really excited about doing this. We hope to roll it out on a larger scale. We also hope to use it as a vehicle for learning more about the integration of tracker data into clinical care, which is the research area that we think is really kind of the key to making trackers and other digital health devices more useful for the general population. Thank you.
Okay, let's start with Ike.
Sure. So I
love this phrase, and I heard a few other people over here also loving the phrase, the modern day Robin Hoods, with talking about collecting these trackers. And I also really enjoyed the anecdote about all of them sort of falling off in the park, and you getting them back. And also that you're like, just even in this setting, connecting this back to the other presentation, and making us all feel more engaged in everything that we're doing here, not just yours. One piece of feedback I would offer is that you might be more effective to make sort of a clearer connection between what the beginning of the presentation seemed as sort of philanthropic, giving people a device that will help them, and then also we're doing research on it. And I understand that there's a connection there, but just sort of making the connection a little more clear about why you're talking about both of these things at the same time.
Okay, thank you. Rich.
Yeah, so very clear speaker. Every word, I was with you. I may have started out, this seems a great presentation to start with a story. If this is helping people, like tell the story of someone who's benefiting and lead with that. Because you're such a clear speaker, you had some visuals that had a lot of bullets going on at once, and so if people are reading bullets, they may not be listening because it's hard to do both at the same time. So I would simplify those and maybe just have, if you're going to put on script, on text, which I would try and keep to a minimum, but if you do that, just one line. And I would also try, if you actually look here, white text on black background actually pops more than black text on white, because the black fades into the side of the screen. So if you think about the end of a movie, right, it's white text on black, and that's for a reason, it's more powerful. So if you ever do use text, white on black is better. So just simplify those slides maybe a little bit more. Yeah.
Thanks. Karen.
Yep, so I agree. I found it crystal clear. I found the organization totally sympathetic and worthy of support. I have to say, my one thought was that, and I don't want, maybe it's your talent at speaking, but it was also just so much conceptually easier than most of the other talks that I thought it kind of underlines how hard science communication is, because you were talking about research and also helping people's health, but I wouldn't call it really so much science, and it's just so much easier on the brain. It was just, and so I found that interesting, that it just seemed easier to be clear than the previous speakers, because you weren't sharing anything that was unfamiliar or hard to wrap your head around. But great job.
Thank you. Christine. I would agree with all of, it's so hard going last and first. Okay. So I just agree with everything that was said. The one piece that I was trying to think about is what was the story? And for me, the story that was coming out was the story of the nonprofit, which was so powerful and compelling. And because I was drawn to that, I kind of lost the story of the research. Mm-hmm. And so for me, I would have liked because it's about kind of communicating about research, I would have liked the story of the research to be front as opposed to the story of the nonprofit. So that was the only criticism. Okay. Thanks, Christine. Thank you.